From a very young age, I knew that I wanted to be a doctor. I wanted security, I wanted excitement, but most of all, I wanted to help people. I entered Sewanee as a naive student who had one goal and one goal only, to get into medical school. I believed that in order to succeed, I needed to put on blinders and focus exclusively on work. I didn't have time for social engagements, extracurriculars, or civic engagement. I realize now how ironic that was. My freshman year, I decided I needed a resume boost and applied to shadow physicians at the local free clinic, Volunteers in Medicine. This is where my journey truly began. Through my daily work at the clinic, I was forced to not only learn about medicine, but learn about my new community. It was here that I learned about the massive healthcare disparity just outside my front door. It was also here that I realized that I couldn't wait 3 more years to take action. Through the advice of my mentor, I applied for a Canale position and was fortunate enough to be accepted into this life-changing program. I began working with another free clinic, Partners for Healing in Tullahoma, Tennessee. Partners for Healing was unlike any free clinic I'd ever seen. It was clean and efficient, and quite honestly, I couldn't tell the difference between Partners for Healing and my own doctor's office. It was inspiring to see how much they had already accomplished. I went from having no desire to get involved to wanting to put on huge programs to address the medical needs of my community all alone. My first semester working there offered a major reality check. We couldn't always find funding for the programs we wanted to put on, and patients weren't always easy to reach. As I spent more time at the clinic and got to know the amazing staff and patients, their needs became so much more clear. I worked on increasing patient numbers by calling each and every inactive patient and posting flyers and distributing materials to local businesses with the help of my interns and bonners. I worked to help find physicians willing to commit to their community and donate their time and resources for free. Through making these calls and visits, I learned the importance of making connections. Local businesses were always thrilled to help spread the word. Patients were touched that the clinic cared enough to reach out and make sure things were okay. The best calls involved patients relaying how Partners for Healing had been there when things got hard. The unique part of Partners for Healing wasn't that they offered free healthcare. It was that they offered a relationship. Nurses knew their patients' entire histories. Office staff knew patients by name and greeted them with big smiles. The clinic offered life coaching, mental health counseling, and prescription assistance, areas typically overlooked. Striving to maintain these relationships and understanding between patients and staff was hugely important to the clinic. Sewanee students interning at the clinic received articles centered around healthcare in Appalachia and how recent Medicaid changes affected those in Coffee, Franklin, and Moore County. We had discussion groups on how this affected the running of the free clinic and where we fit into it as future healthcare professionals. Leading these groups helped me, as well as fellow Sewanee students, to expand our understanding of the work we were doing. I recognized that in just 1 year, I would be in a position to directly affect people's access to healthcare. Returning to the Sewanee community, I realized that many students like myself went without access here to healthcare because of cost, in-network physicians, and location. After speaking with staff from the local clinics and the campus wellness center, I decided to bring local free healthcare options onto the domain with the help of Partners for Healing. Through an introductory healthcare access newsletter and an application day, we hope to bridge the gap between Sewanee and the surrounding community and offer healthcare to those in need. I came into Sewanee with my eyes tightly shut to the problems around me. Over the last 2 years, working with Partners for Healing has taught me so many things. I learned that making connections will never be in vain. I learned that sometimes the little things can have the most impact. And I learned the impact that I can make if only I open my eyes to the world around me. I've loved my experiences as a Canale so far. Working with Partners for Healing staff and patients has been one of the most inspiring, educational, and amazing experiences of my life. I'm so grateful to have been given this opportunity and plan to take the many lessons I've learned along with me through my journey to become a doctor.